Hello, back again with another episode of Real Health Talk with Dr. Coring. My name is Dr. Coring. For those who do not know me, I am a board certified internal medicine physician who is passionate about educating common folks such as yourself regarding your health, being well. And so, what I like to do is discuss various but practical health topics that affect everyday people in order to help people be well. I'm passionate about health literacy, and I feel as though knowledge is power, and therefore health is wealth. And so let's talk about it. And so the topic I would like to discuss today is high blood pressure and its relationship with sleep apnea. Um, I don't know if many people are aware, but when I see patients who are newly diagnosed with high blood pressure, I typically screen them for sleep apnea. Basically, just making sure that they're not meeting the signs and symptoms of sleep apnea and or have been diagnosed with sleep apnea, because it's very important to understand that sleep apnea, specifically obstructive sleep apnea, has a high association with high blood pressure. All right, so it's very common, uh, so much so that 50% of people with obstructive sleep apnea have high blood pressure. Also, research shows that 30% of people with high blood pressure also have sleep apnea. And so typically what I'm saying is the sleep apnea oftentimes come first, then the high blood pressure. All right. The 30% of people with high blood pressure also have sleep apnea, meaning the sleep apnea is coincidental. You have the high blood pressure first, and then coincidentally, you have obstructive sleep apnea. But what I'm trying to say is the obstructive sleep apnea can come first, and then the high blood pressure. And so, therefore, if you can have or gain control of the obstructive sleep apnea, and or even prevent obstructive sleep apnea in the first place, then you can also prevent high blood pressure. And so that's why it's very important to discuss this topic, simply because if you have high blood pressure, then you may have obstructive sleep apnea, and therefore if you treat the obstructive sleep apnea, then that can in turn improve your blood pressure. All right. And also, if you have obstructive sleep apnea, then that's you should be screened for high blood pressure because there's a close association. All right. And so, why does this happen? How does obstructive sleep apnea affect your blood pressure? Why do people with obstructive sleep apnea go on to develop high blood pressure? Well, it seems as though when you have obstructive sleep apnea, meaning when you're breathing or sleeping, essentially you stop breathing. And it could be because of an obstruction, meaning an airway obstruction. Mainly that's what's going on. And you're stopping breathing frequently during your sleep, and that's how you get obstructive sleep apnea. Well, when you stop breathing while you're sleeping, you tend to lose the capacity to distribute oxygen to various organs, and that can create something called hypoxia. And so, stopping the process of breathing while you're sleeping can lead to decreased oxygen, and therefore lead to increased carbon dioxide. And carbon dioxide can affect your tissues, can lead to something called acidosis, and therefore increase the blood pressure. And so that's the primary reason. Other reasons is, you know, the obstructive sleep apnea can cause inflammation throughout the body, can also increase the sympathetic nervous system, which increases the sympathetic neurotransmitters like adrenaline. Also, it can create oxidative stress. So there are other reasons, minute reasons, why your blood pressure increase because of this obstructive sleep apnea. But the primary reason is the carbon dioxide increase, which causes acidosis. All right. And so what we typically find is that once we start to treat the obstructive sleep apnea with something called continuous uh, positive airway pressure, or CPAP. So continuous positive airway pressure, also known as CPAP, actually allows you, even when you stop breathing, it continuously allow oxygen, positive pressure, what we call oxygen, to enter your lungs, and therefore decreases the carbon dioxide, keeps the oxygen levels normal even though you're stopping breathing, and that therefore the acidosis is not there anymore. And once the acidosis is essentially not there, then that can help reduce the hypertension. And so essentially now we're treating the obstructive sleep apnea with CPAP. And therefore that can help treat the hypertension. But we also understand that it only reduces the blood pressure by a little bit, maybe 10 to 15 points, if we're talking the systolic number, the top number. And so therefore it's often the case is that you get diagnosed with obstructive sleep apnea, you start the treatment with CPAP machine, but you still may need help reducing your blood pressure with medicine, antihypertensives. And so we typically still have to keep you on the medicine, the antihypertensives. We may come down on the dose a little bit, but it's typical that you still may need it. And so we encourage other ways to reduce the blood pressure with this healthy diet, meaning the DASH diet. That's the diet against or to stop hypertension. All right, that's a low sodium diet. 2,400, well, actually 1,200 milligrams of sodium per day is what's recommended. We also recommend the Mediterranean diet, meaning diet low red meats, high in what we call the olive oils, high in lamb, high in tomatoes, hummus, basically almost a vegetarian diet. But you can eat like healthy meats, like fish, for example. Also exercise 30 minutes a day, at least more days out of the week, so 4 to 5 days out of the week. Also, stopping smoking can also help reduce the blood pressure as well. And so basically, we group these recommendations as lifestyle changes. And so lifestyle changes can also help reduce the blood pressure as well. And so what am I trying to say overall? Overall, what I'm trying to say is if you were just diagnosed with high blood pressure, you should ask the question, do I have sleep apnea? And the way to help answer this question is you can take a self-assessment yourself. Do you snore? And maybe you don't know if you snore. So ask your partner, do you snore? Do people complain to you about your snoring? Are you obese? Is your neck circumference greater than 44 centimeters? If you're answering yes to these questions, then you may have obstructive sleep apnea. Do you have headaches throughout the day? Are you sleeping throughout the day? Are you tired throughout the day? If the answer is yes, then you may have obstructive sleep apnea. And therefore, you should go to your primary care provider and discuss these symptoms. And therefore, your primary care provider will likely prescribe you to have a sleep study done. And then that sleep study will likely diagnose you or not diagnose you of sleep apnea. And therefore, if you have high blood pressure and now have been diagnosed with obstructive sleep apnea, then this may help reduce your blood pressure. And then also, obstructive sleep apnea have been known to be linked to other diseases, such as heart failure, such as atrial fibrillation. And so being treated adequately for obstructive sleep apnea can also help reduce these things, such as heart failure, such as atrial fibrillation. All right? And so The biggest takeaway here is that if you have high blood pressure, you should be assessed for obstructive sleep apnea. If you have obstructive sleep apnea, you should be assessed for high blood pressure. In order to prevent high blood pressure, you should prevent obstructive sleep apnea. And sometimes a good way to prevent obstructive sleep apnea is to lose weight because obesity is highly linked to obstructive sleep apnea. That's my time, guys. I love you guys. Make sure you get screened for obstructive sleep apnea if you're meeting the signs and symptoms of obstructive sleep apnea. All right. Peace. Like and subscribe too. Please. Peace.